Hello, everyone. We're going to give people a couple minutes to get logged in. Uh, it is a highly sought after event. I do know that we'll have a lot more registrations than we have people attending. Many people, because of the short notice, had a conflict, but they registered so that they get the recording. But we'll give everybody a minute or two before we get started. Is Rich joining us, Taylor?
He is not. He's got an
Okay.
open enrollment going on right now. Fun enough.
Likely excuse.
It's that time of year.
I think that that's why many of our HR professionals that are members of the network are unable to attend today. It seems they're busy or something.
I know. There's also a lot of dividing and conquering that happens within our team. So I always have to apologize when a team gets me for their open enrollment meetings. I'm like, hey, there's a lot better spoken people than me. Y'all drew the short straw, so let's get into it.
Well, great. You just set really high
Yeah.
expectations for the call, Taylor.
It's anchoring low, under promise and hopefully over delivered.
That's awesome. I'm sure that you will over deliver. What I have been telling most people, or what I've been telling everyone, is I'm trying to explain what's going on. Like, I'm going to tell you what I know. And when I get to the end, you can't ask any questions because that's the extent of what I know. Because that's why we have professionals like you all. So,
Well, we're all figuring it out together. That's the good news.
um, All right. I think that we should go ahead and get started for the sake of time. So I wanted to introduce all of you to Taylor Rogers and to Scott Gardner, who are going to lead today's discussion. CCIG, Taylor and Rich Haney have been partners of the Mortgage Collaborative for a long time, originally under Karen Advisors, now as CCIG. And we've had many conversations on really different ends of the spectrum for myself and the relationship that I've had with Karen Advisors turned CCIG. I was a lender and was taking a company that I was leading to self-insured, and they were instrumental and strategic advisors through that process. Amazing individuals to know just as human beings, and then to also have the opportunity to do business with them is equally as great. But CCIG is a proud partner of the Mortgage Collaborative, and we want to be able to solve problems for the industry. And one of the largest ones that our members face and even partners face is rising healthcare cost year over year, being able to manage that when our jobs are to run mortgage companies or to run companies that support mortgage companies, and we don't have the expertise that feels like is needed to make informed decisions when it's related to healthcare. So the Mortgage Collaborative wants to, in partnership with CCIG, bring our network the benefits of a health insurance captive that allows us to be able to spread risk out over multiple companies and to help reduce the individual risk of our members when it's related to healthcare insurance for their employees. So I'm going to allow Taylor and Scott. So Taylor is one of the founders of CCIG, and Scott is the data guy that I hear will make all of our dreams come true. Um, Taylor referred to him as the stop loss
The
guy.
Wizard of Stop Loss. He's like our Gandalf on our team. If anybody's seen The Lord of the Rings, he's the guy with all the answers. So I had to bring him.
Yeah, so we're very lucky to have Scott join us, especially since Taylor gave such a glowing review of his presentation skills before we got started. So I think that Scott, you might have to run things here for a bit. For all of the audience, thank you so much for taking the opportunity to join us. The chat feature is open, so any questions that you have, please put those in the chat. This will be interactive. I'll hop back into the conversation and ask Taylor and Scott your questions as we go. And with that, Taylor, Scott, save me from myself and my lack of health insurance
Yeah.
knowledge.
That's what we're here for. Well, thank you, Jody. It's obviously been a pleasure to know you for several years now, and work with the TMC family, here for the last 4 years. I think we've been to 7 or 8 of the conferences at this point, and so I'm sure I've seen and met a lot of you over those years. But if not, look for the tall, goofy guy talking about health insurance here in the spring. So. Scott Gardner, as I mentioned, is here. He keeps me in line. He clarifies the things that I may say incorrectly, so I openly invite him to pipe in and correct anything that I'm saying that's out of line. But with all that being said, we're going to kind of hop in here. The agenda we're going to run through, this is a really basic agenda, and I want to keep this at a high enough level where you understand what we're talking about and what we're going through, but cover enough depth that you understand the substance. There's a lot of substance underneath this program. But healthcare and health insurance, as I'm sure you've all experienced, can get really complex and really deep really fast. So I don't want to drag you into too deep of water before we know where we're going. So we're going to talk on who's a good fit for the captive. That'll take the air for the program. I'm sorry, the cooperative. That'll take just a moment. How the model actually is designed to work. And then what are the practical next steps that you would take if you want to join this cooperative or you want to explore it? And then we want to save a lot of time for your questions and answers. I've always found that that's kind of the most fruitful part of these discussions, so we won't keep you waiting too long on that piece. Really quickly, I've already spoken to several folks that have expressed interest in the program, and there's really kind of three pieces that in my mind are identify a good fit. One, you're an active member at TMC. This is meant to be a huge benefit on a very large lever within your organizations for TMC members and preferred partners. You'll find out why that's important here in just a little bit as well. Organizations with 50 plus enrolled employee lives, and or roughly $1 million in premium are the organizations that are going to see a lot of benefit from this. Those are not hard and fast numbers. Those are ballpark numbers. And the reason being is because when you move into a program like this, a self-funded health plan like Jody just discussed, that's what this is. Um, there is a level at which if you're not spending a whole lot of money, there's just not a lot of opportunity for you to meaningfully save. You're going to have such a low deductible that really your claims fund and the opportunity to see a big benefit from it gets reduced. And I would tell a company if you're trying to save $15,000 on a $300,000 spend, there are better ways to spend your energy and your time. It's a big lever when we've got a big rock on the other end of it. So if it's a smaller plan, there's only so much you can do, and a lot of the cost is going to go toward fixed costs of managing the program. Maybe not worth it. So we can discuss that more one-off if you have specific questions to your company, but use those two benchmarks as a rough calibration. And then the last one is important. We have here greater than 65% of your eligible population is enrolled. This again is not particularly hard and fast. However, what is hard and fast here is you have to have the fundamentals of a plan that's going to perform well over time. The fundamental of insurance is a spread of risk. We need healthy bodies on the plan because the healthy bodies help pay for the folks who are incurring large claims. And then 2 years from now, some of those healthy bodies are going to turn into your large claimants. Your large claimants hopefully turn back into healthy bodies, and you have a nice spread of risk. If you fall below about 2/3 of your eligible population enrolled, that's a red flag of poor participation, and that becomes a spiral that's hard to get out of. So that's just a fundamental of we need a plan where people are signing up for it even when they're healthy, especially when they're healthy, so that we can sustain long-term success with that plan. So if you're not there today on the participation, we're here for counsel. We can help you coach you up on how to get better fundamentals in place so that maybe next year at renewal or the following year you are a fit to join the program. You do have the fundamentals in place to participate in something like this. So before I hop into the next page, because there's a lot of information that we're going to cover, I like to use analogies here. The way this program is designed to work, imagine you're walking into your biggest final. You're back in college. You're walking into a Calc, 204 final or something like that. And when you walk in to take that final, the professor says, "Hey, just so you guys know, if you want to huddle up into groups of 5 or 10, you can take the test with a group of other folks. But you're all submitting your own tests. You're all getting your own grade. If you're smart, you're going to go find 5 or 6 A students and you're going to do your test with them. So you have other people with great ideas and maybe can fill in your knowledge gaps. That's effectively what we're trying to do here. Every company that joins the cooperative or the program are going to experience the benefits that come from having other smart and experienced people in their corner helping them make decisions, but they're still going to turn in their own paper. They're still going to get their own grade. You're going to have your own plan, your own stop loss contract, your own contributions, and you can decide what you want to cover, etc. But you're going to have a lot of safety in the broad program-wide decisions that get made. So hopefully that gives you a little bit of clarity into kind of what this is going to look like. So before we hop into any mechanics, also, I just want to touch on this. I felt like this was a really important article to lead with. Mark Cuban was with the Texas Business Hall of Fame earlier this year, and he said to every business owner present in the audience, "You need to hire a chief health plan officer. It's the most important role in business today because the healthcare grift is so large." If you follow Mark Cuban at all, you know that he started Mark Cuban's Cost Plus Drugs for prescription drug purchasing. He's now in the contracting space where he's publishing direct contracts with provider groups, physician groups that are available to employers. He's become very passionate about this area, but he feels like every company needs an executive dedicated just to the health plan. The pushback I have on that is that doesn't make sense for a lot of companies. If you've got 200 or 300 employees, you're not going to dedicate a C-suite role 365 days a year to a $3 million, $4 million health plan. There's just not enough return on that investment to have that role. But what does make sense is to effectively have that same level of investment and oversight as a collective and as a purchasing group. And that's exactly what you guys will have access to as part of this program. So, real quick, the objectives of the program are pretty simple. TMC wants to provide a long lever that helps provide meaningful opportunity for your business, helps increase your earnings, helps you with retaining your profits. They also want to help you as an individual company retain and attract your employees by offering a great benefits package that's very well thought out. It's very intentional. The other thing that we have the opportunity to do is to kind of minimize the cash outlay of going into a program like this. So you'll kind of hear and learn more about this, but by again purchasing as a collective, by negotiating contracts as a collective, we're going to minimize some of those barriers, some of the time investment and the financial investment to join the program. And then finally, the structure to yield meaningful savings. Very simple way to say this is your health insurance is a function of two things: the unit cost of your healthcare that's utilized within your population and the number of units that you use. It's not really more complicated than that. What we want to do is help make sure that you're minimizing the unit cost that you're paying for healthcare services and that you're developing a healthier population, driving the right behaviors for your folks so that healthier folks are obviously not only more productive, but not as likely to drive large claims activity for your plan. Way we're going to do that, there's going to be a committee, okay? So we want you guys to vote, elect a committee that oversees a lot of this work. So one example of a responsibility might be to say, hey, we're going to select a third-party administrator. We're going to select a pharmacy benefit manager for the program at large, okay? We're going to have a committee of folks, and there are some really, really brilliant minds within TMC that know healthcare well, that have managed self-funded plans, and they're going to effectively be the governing body that reads through the contracts, that makes sure we're negotiating the right provisions that you then benefit from. So the committee is going to have a really important role. They're going to participate in this program within their own companies as well, and provide meaningful counsel from your peers who have the same motives that you do. The advisors, that's the team here at CCIG. We manage self-funded health plans every day for every industry you can think of across the United States. And we do it every day. And so this would effectively take the role of a broker. We're going to help you with all your compliance. We're going to make sure that your stop loss is placed and underwritten appropriately. We're going to help give you guidance on what your program coverage looks like, what you want your deductibles and your out-of-pockets to look like, and how you set that whole thing up. So you will have that full team, so compliance, underwriting, et cetera. Administrative support. This is one of the big barriers that I mentioned. The barriers to jumping into a program like this is if you don't know what you're doing, you've never done it before, administratively, it can be a bit of a challenge. You're setting up new EDI feeds with your technology, your payroll vendor. You're setting up new, processes with your third party administrator, how you pay claims, who's paying your invoices, all that sort of thing. So, what we want to do is offer you some supplemental administrative support through a group that we've vetted and selected, where you'll get 6 to 8 hours a month of support from that fractional HR team to help shorten your runway. And then once you get your feet under you, you feel like internally you have a great grasp of it. You can sunset that piece off if you like. You can keep them around if you like, but they're going to help guide you through that transition. Individual members are going to have a huge responsibility in this. You're going to have full voting rights when issues come up or when new solutions. For example, we as a organization want to go out and select a fertility benefit provider. Here's the four that are great in the market. You'll be able to vote on the one that you would like to see included in the program. And also, you're going to be a great peer support for the other folks in the organization. We anticipate that at the TMC meetings in the spring and the fall, the committee and the members are going to get together. So it's twice a year, talk about what's working, what they'd like to see changed, and go from there and hopefully have a tide that lifts all the boats. And then finally, this one's going to be important. I haven't touched on the risk financing side, the insurance side much yet, but we anticipate this going into a captive program. And we can explain why that is, why we've selected this. But here's a few bullets on it. So it's a mechanism to purchase stop loss insurance at a very high level. However, captives can be very selective and cherry pick who they sell coverage to, who they allow into the captive cell. So a great captive manager is going to discriminate heavily on who gets to come in because they want a really clean risk pool. If you were an auto insurance underwriter and you could make sure that you're only writing insurance on people that don't drive 95 miles an hour and don't drink alcohol, that's going to be a great auto insurance carrier. They're going to have fewer losses and you're going to have lower premiums. That's the point of a captive. You get to cherry pick that a little bit. The other really big one is there's the opportunity for return of premium. So if you're a group that runs really beautifully one year, you're going to have an opportunity to get money back from the premium that you paid to that insurance carrier. Most programs that you're in today, stop loss wise, you're not getting any money back. You're paying the insurance premium, they're paying out claims, they adjust your premium the next year, but they're never going to say, hey, wait, you were our prized, pupil this year. We're going to give you 30% of your premium back. That is an opportunity in a captive. So that's kind of why we've chosen this mechanism. I have a really grainy photograph here that I'm going to apologize for. But as you can kind of see here, this is a real exhibit that we've de-identified from a captive cell. And this little column here that you can't really read is captive funding. I just want to point out one thing. This is a group, this third one down, that they had $302,000 of stop loss premium put into the captive. At the end of the treaty year, they had $0 in paid claims. So they were due for $125,000 of premium returned. So that group had a great year, didn't have any catastrophic losses. They got a third of their premium back, right? Some of the other groups you can see ran a little bit hot and didn't get much money. This one got $710 back. They ran poorly. So the captive itself ran well. It distributed money back to the participants, but it was returned to the folks who had the best year on kind of a pro rata basis. So that's the captive in a nutshell. Captive manager plays a really important role in helping you keep the pool clean and free of debris so that it's good for everybody. pause there. Are there any questions we need to tackle before we go any further, Jody? Or
I haven't seen any yet.
okay,
You're doing such an amazing job of explaining. We'll let you proceed.
awesome. Well, if nothing else, I got a drink of water. Scott, anything you want to add, go for it as we go along. So that's at a high level, guys, just how the program is designed to work. Again, think of it like a final where you get to work with a group. There's no downside to having a group of peers that know a lot and could be valuable for you. And you're not really adding any additional risk to yourself for doing that. I'm going to circle back to most of this information here, but I liked this graphic to kind of show you why we picked this particular structure for the program. This is a kind of a busy spectrum or continuum. I have a feeling a lot of companies, and a lot of companies we have talked to in TMC over the years are over here, fully insured, non-participating. If you're fully insured, this is just a standard fully insured contract the end of the year, you pay $1 million in premium, they pay $600,000 in claims, they keep that $400,000 delta, and then they adjust your premiums the next year accordingly. That's how a fully insured contract works. As you can see on here, it really just optimizes for flexibility. That's kind of it because they allow you to terminate that contract at the end of any month and there's no tail, no liability, no anything. You can walk away. It's like living in an Airbnb, basically. So there are advantages there from a flexibility standpoint, but a lot of folks, particularly in the mortgage business, where y'all's margins are so thin and the war for talent is very high. We talk to you guys. We know how hard it is to find and keep good LOs in your business. You're not getting the value out of it that you would, here over at the other end of the spectrum. So skipping ahead to kind of what we selected this self-funded with a stop loss captive. Again, because you get full flexibility, data ownership, ability to control what your plan covers and doesn't cover, ability to make judgment decisions and so forth. And when you have that great year, you're not only keeping your claim fund dollars that you didn't spend, but you're also going to potentially qualify for a return of some of your premium, which is huge. So we just feel like over time, it's the most efficient way to purchase health insurance. Our team is going to provide you with monthly claim reporting if you're in this program. I've got some samples here of that, but just know that you will always have a clear line of sight into how your plan's running, what your large claimants are, how they're tracking month over month, where you're spending, which categories you're spending a lot of money in, so we can sit down with you and say, hey, we think we need to make some tweaks or plan design changes or maybe implement a solution for oncology. You had 6 cancer claimants this year that were all pretty catastrophic. We can work through that because we own the data. Um, that's important because down here on the pharmacy side, you can see that these are all real examples of popular drugs that you see out there. And you see that the price can vary everything from $7,700 to $2,500 to $634 for the biosimilar. We want your program to always default to the lowest net cost. It's going to benefit your members, it's going to benefit the plan, the contributions that your folks pay, et cetera. So this is the real meat and potatoes of how a plan lowers their unit cost and their number of units. Again, going back to that piece, is just making sure that your plan is designed to take advantage of all of the lowest net cost opportunities that are out there. Okay. I'm not going to go too deep into this, but these are just some more examples of different areas where we can focus, whether it's cancer, whether it's surgical bundles or dialysis carve outs, all of that's part of it. And then I wanted to pause here for one moment just to say, this is all very complex, and I understand that. And so this is what a self-funded plan looks like. And to some extent, it's what a fully insured plan looks like as well. It's just all bundled together. But there's a lot of components here. If this all feels and sounds intimidating, that's why the cooperative makes sense. You've got people who understand this really well, and you've got a lot of people vetting that you're getting sound advice and sound counsel. So you don't have to know what a utilization and case management vendor, what a good one or a bad one looks like. You're going to have strength in numbers to make those decisions. Jody, you had something?
Yes, I have a question that came up, and I think that it's a typical question. It's a question I've asked in the past, and I think it's probably what others are thinking too. So the question is, It's loaded. It's a couple questions in one question. Are our premiums based on past experience? Are you saying that if we have a good year, we could get some of that back? That's true. Are self-insured plans typically less expensive than our current normal insurance plans, fully insured plans?
It's a great question. So, great series of questions. So, I'm going to start with a very basic principle here. Self-insured plans offer the opportunity to provide far more value to the organization, to let your dollar go further. So, what I mean by that, if I pay $1 in premium to a fully insured plan, I can expect about 80 cents of that dollar to go toward paying claims. Okay. When I go into a self-funded plan, what I'm effectively doing is I'm buying less insurance and I'm paying more claims with whole dollars. So instead of paying each dollar of claims or each 80 cents of claims with a full dollar, I'm now paying $1 of claims with a dollar. And so I see opportunity there. The other piece too is I'm also not paying premium taxes and so forth on the full cost of my health insurance. I'm only spending it on that bit of reinsurance, which is about 20% of my plan. So there are just some inherent efficiencies that are at play before we even get into the cost management side of lower net cost prescription drugs, et cetera. So that's why the self-funding model does and can save money. But there are certainly some intricacies that we can get lost in as far as how the risk and the trade-offs work. Was there another piece I missed to that question? I'm sure there was, Jody.
Yes. So the other piece of that was, yes, you can get money back. So if
Yes,
you're,
that's
if,
correct.
and then the other piece of it was, are self-insured plans typically less expensive? But I think that you answered that part
So
than
yeah, the one piece I would add to that is a big, broad, large study showed that in the first year of self-funding, about 85% of companies come out better self-funded than they would have been fully insured. When you get to 5 years, that goes up to 97%. So 97% of the time, it's less expensive. And when you zoom out to 10 years, it's 99.8%. So basically, if you zoom out far enough, you win in a self-funded model. It's just, it depends. Obviously, if you go into a self-funded model in that year, you have 3 or 4 just unforeseen catastrophic losses. There is a potential that you could pay about 15 to 20% more in that first year because you have a more variability to your cost structure. You still have a firm line in the sand. There is a do not cross. This is your maximum cash outlay, so you can budget to that number. But anything that comes in below that is obviously variable, and that's yours to keep.
Yep.
So hopefully that makes sense.
That answers. We have a follow-up question to that, and then I'll go back because now we got people talking. We got
That's good.
everybody's
That means they're
thinking.
listening. I see that as a good thing.
The brains are all warmed up. Here we go. So the follow-up to that piece was, so if I'm paying my claims only, then why is there leftover money if I have a good year? I know the answer to that question. I'm going to let you answer it because it'll be far more sophisticated than I can answer. But the question is, didn't the money all go towards paying claims?
Great question. I'm going to let Scott answer this one. Y'all have heard me talk enough. This is his domain.
So it's really based on an annual budget forecast, right? So there's multiple components of the plan. There's the fixed cost for having a TPA and a network and a pharmacy benefit manager. The second piece is the claims bucket, which is the biggest bucket. And the third part is the reinsurance, the premium to the captive to account for catastrophic claims. And really, it's that claims bucket. So we budget to a certain number, but if your plan does well and doesn't have a lot of large claims, um, one, you're spending less than what you allocated to your claims bucket. And the other piece, as far as getting money back, that is premium for the reinsurance. So if you don't have large claims or on the smaller side of the large claims, there's an opportunity to get some of that reinsurance premium back. And that kind of goes to the next question of how do we handle large claimants? That's what we're talking about in this captive type program. So each group, each member would have their own limit of liability per belly button. That would be their layer. And then we would go into a shared layer within the captive. And then for really catastrophic claims, the collective, the captive itself would purchase catastrophic coverage just to protect the captive.
Great summary. Yeah, that's what I would say is it's really just a budget exercise. So I'm going to use a $1.2 million fully insured plan just for the sake of a very round number. I'm paying $100,000 in premium every single month to that fully insured carrier. Whether I have $200,000 in claims or whether I have $20,000 in claims, I'm paying $100,000 a month. In a self-funded plan, I have my budget, which accrues kind of month over month. And actually, I think I've got a sample of that here. So you can kind of see what we're talking about. You'll see the budget tracking throughout the year, and the budget will accrue on a monthly basis. And then you'll see whether you're above or you're below your budget. But the money doesn't leave your account until those claims need to be paid to the physician. And so by staying in your account, you're carrying the liability on your balance sheet, but you've still got cash in the door. And there's a lot of other details on how you set your budget and how you allocate your cash flow, and whether or not you put it into a claims account or keep it in a general account and fund as you go. There's a bunch of ways to skin that cat, just depending on how your organization operates. But that's where we coach you on that piece. So
And then also, Taylor, you went over this. Some people may have been coming in late, but is there a employee threshold at which self-funding no longer makes sense? And then
yeah,
additionally, if a company anticipates significant employee growth in the coming years, does it still make sense to move to self-funded plan, or is it better to wait until there's more claims history on the expanded population?
great question. So as a general rule, and Scott, you can add color to this as well, but growth doesn't scare us. Growth is great. It's always good for a plan. The more belly buttons and the more spread of risk we can get, the more stability that we have in that program. So growth is a good thing. Where I would tell you, you need to stop, hit pause, maybe think about it, talk to our team about it, is if you are expecting, hey, we have this division with 30–40% of our employees, and we're probably going to sell off this division. Or, we're under NDA for a couple folks that are thinking about acquiring our firm. These things take a little bit of time to flesh out to start to show meaningful results. And so I would tell you if you are actively shopping your business or you have very real plans to reduce headcount by more than probably 15%, then you probably need to pause and make sure that you have some forecast of growth. But growth by itself, not really a bad thing. Scott, what would you add to that?
From an underwriting point of view, if you're really in a perpetual state of growth, it's actually ideal to be self-funded. When you're fully insured and growing, you're paying all the premium to the insurance company from day one of coverage, even though that person may not incur any claims in the short term or the long term. So, being self-funded, you get the opportunity to save those dollars up front while that member is not incurring claims. So it's really a kind of an ideal characteristic of a company to be self-funded is if they're growing in headcount regularly.
And Jody, to answer your other question or to circle back for the folks that were a little bit late. So who's a fit for the self-funding in general is going to be kind of these second 2 points here, which is you really want at least 50 enrolled employees, and probably about $1 million in total annual premium. That's including the employer and the employee contributions. Neither of those are hard and fast numbers, but there is a certain level of economies of scale that need to be achieved to offset the cost of simply administering the plan to create opportunity for this to yield meaningful savings to you. So if you're only spending $300,000 or $400,000 to cover the population, we're probably going to use 50–60% of that at least just to pay for your stop loss and your administrative costs. And at that point, you have to run extraordinarily well to pocket meaningful money on the back end. And so you just it's kind of a math problem a little bit, but that's why I use about $1 million as kind of the point where there's real opportunity.
The tagging on to that, we have a question in the question answer. Are there any state-specific restrictions or requirements? In the past, we've been subject to where a company's home office has been located, which could be higher than in other states.
Scott, you want to tackle this? You want me to?
No, go ahead. I'm going with right to ERISA preempt state rules for self-funded
Yeah.
plans, but I'll let you go.
That's yeah, no, you're spot on. So that's the beauty of being in a self-funded plan is you're governed by ERISA. So you're governed by federal governance, and you also have the ability to elect which state you mirror for your benefit requirements. Just candidly, most self-funded plans pick the state of Utah. It's very, very friendly in terms of what it requires you to mirror and to offer. So you have a lot of you have discretion there as long as you're abiding by ERISA. But the good news is, like, if your headquarters in California or even Ohio has some unique regulations, you're no longer subject to the state-specific requirements that are required by fully insured plans. And I want to give you one small example that's just come out. The state of California, for fully insured plans over 100 lives, now requires those plans to cover the cost of fertility treatment. And I'm just telling you, as a risk manager, this is a big deal. It's a very big deal because as IVF's a miracle. I've got two twin nieces and nephews that are a product of IVF, but I'm telling you, it leads to multiple births, leads to more geriatric pregnancies, leads to more NICU admissions. All the data's there. And so I say that to say it is good to preempt state-specific laws because sometimes those state-specific laws are very expensive for the employer. And if you can get away from that, that's actually a very good thing.
And I think that that demonstrates the value of the partnership with CCIG because, that's not stuff that we are going to know. We have a hard enough time keeping up with the changing regulation within mortgage, where
Right.
if we can have a strategic partner that's able to help keep us informed and look out for our risk, it's even more reason to partner. I'm going to keep going with the questions if you're good with that, or do you
Yeah,
want me
that's
to
great.
pause? Okay, okay. Um, so, question, I think we may have answered this, but want to make sure that I don't glaze over it. What if you are coming off of a year with a high loss ratio, 118%, and have some fairly large and open pending claims into 2026? How will that affect the eligibility of the cooperative?
A great question. And I could absolutely answer this, but I'm going to let Scott because Scott's our wizard of stop loss.
You, it's interesting when you're fully insured, the best you can do is tie, right? Regardless if your loss ratio is really high or if your loss ratio is really low, you pay the premium to the insurance company, and I will tell you, almost no matter how low your loss ratio is, you're still going to see a premium increase in the next year. The one thing that's awesome about being self-funded is each year starts anew. So if you did have a high loss ratio last year, we're starting the new year at zero. The other bit is the opportunity with being self-funded. If you're fully insured right now and you have a really high loss ratio, and not to pick on anybody, but I'll go with Cigna and Express Scripts because they're the most egregious from the pharmacy side. Is that insurance company creating your high loss ratio? Are they buying drugs at twice the amount they should? Are they keeping all those rebates on the pharmacy and not showing that to you? Are they paying exorbitant fees when someone goes to an out of network substance abuse facility for 60 days? So it's really a matter of diving into that 118% loss ratio and find out what's driving it. If it is the health plan driving it, is it your members driving it? Is it the lack of opportunity to have some bolt-on programs for cost management? Um, the insurance company is beholden to shareholders, right? Their job is to make money um, for their organization, and our job and the goal of this collective is to get the appropriate care at the appropriate place at the appropriate cost. And I'll also say it's really a two-way street, right? As an employer, we want to do the best for, as what Taylor said, lowering the number of units consumed and lowering the price per unit of that which is being consumed. But to be high performing, we all have to participate. So you as leadership have to be willing to put in programs that require folks to acquire drugs at a different place, reach out to say, hey, maybe we can do this infusion or injection in your house instead of an outpatient facility to lower the unit cost. So it's really a two-way street. What's driving your 118%? What can we do to affect that from a supply side or a demand side to have membership be a bit more responsible and taking care of themselves, getting age appropriate screenings, annual physicals, and how do we drive that cost down long term?
I'm going to give you just a real practical story because while I was in Boston, if anybody happened to be walking out of, I don't know if it was the east doors or whatever of the hotel, you would have seen me standing pacing on my cell phone by the doors while we were at the conference. And I was spending that time. We had a member with a very aggressive form of cancer who happened to be the owner of the company. And they were going to be projected at about $750,000 of claims. And this was going to be a sticking point because that member by themselves made the stop loss offer to leave the plan that they were on uncompetitive. On that call, talking with the business owner, talking with the folks involved, we were able to get that member put onto an individual plan through a charitable nonprofit, and the company paid $55,000 to offload that risk. The member had their out-of-pockets, their premiums, everything paid for. So they basically got a free health insurance plan, and all of the costs of care throughout the year were taken care of on a marketplace Blue Cross plan. And we removed $750,000 of laser liability or of individual liability off of that plan. So now their stop loss offer became competitive because of what we were able to do. We can't do those things in a fully insured program, but that was the ability to place the risk. And that's part of our job is to work with you guys to make you viable for this type of program. And if we can't, full disclosure, if that hadn't been the owner of the company, if that had been somebody that was just completely opposed to the strategy that we had come up with, they might have had to stay where they were at. And these things happen sometimes. But once you get people into the program, getting in is the hardest part. We have to make you presentable to the board, make you presentable to the captive, and make that underwriter really love you. And then when they do and you get in, you have all the benefits of membership. But that's what we're here for, is to help you get into the program. So I wouldn't say a 118 is a deal breaker by any stretch of the imagination, but the devil is entirely in the details, and we would work tirelessly to make sure that we did everything we could.
All right, I have the answer to the next question. Are you able to look at our claims history and tell us if we would be a good fit for self-funded? We have the claims data from our renewal this past year. Absolutely. And it's also the purpose of the call today. So I've collected your name. We'll reach back out to you so that CCIG can have a conversation and start to look at that, and also can help in determining what you should budget for from a claims perspective based on that data. This one, I really need your help. Um, how do you transfer from an ICHRA into a captive? I don't know
The
what
short,
that
the
means.
short answer is you don't on some level, and I know that's a bad answer. But the truth of the matter is when you go into an ICRA, which just for anyone who doesn't know who's on this call, an ICRA is a strategy a lot of companies have used to basically provide a stipend through a health reimbursement account for employees to go purchase individual coverage in the marketplace.
Got
So
it.
effectively, that company has ceased to offer a group health plan and has put that responsibility on the employees to go find coverage for themselves. This sounds really good in theory, ICRAs do, until you go see what's out in the marketplace and you see how expensive they've gotten, especially as the subsidies have been pulled back. And so we're seeing this a lot where companies are trying to now go back into a group health plan. The problem you're going to have if you're in an ICHRA today is you have no data because you don't have a plan today. So we don't even have a gauge of participation. We don't have anything. So in most of those cases, a stop loss underwriter is going to be too uncomfortable with the lack of any insight as to the risk under the hood. And so you're in all likelihood going to have to take that first baby step back into a virgin group plan, start to harvest the data, and then broadcast that.
Awesome. Thank you, Taylor. Also, on this one, I know it's in the question and answers, but I'll go ahead and ask it as one of our members is asking it. Our new plan year starts in January. Would we need to wait until next January to join? If we can change mid-year, can our employees stay in their current plans, or would they need to re-enroll? And you and I had this discussion related to deductibles. So if you could answer that question, but also answer how the deductibles work, how Rich explained it to me, that would be, I think, would work best.
Yeah. So first of all, there's some variability to the answer to this question, which is, are you coming from a fully insured plan? Are you coming from a level funded or self-funded plan? That has a little bit to do with when you can terminate and when you can go back. If you were self-funded today, but maybe call it Cigna ASO self-funded, and not a program like we're talking about, we advise never break a stop loss contract early, outside of very rare scenarios. If you're fully insured, however, you technically could chop that off at the end of any month that's upcoming. What I would tell you, this is one of the elements to, the captive structure is we are going to have one renewal date for the captive cell, for the stop loss covenant. We have not decided that yet because that's not our decision to make. That's going to be a decision that's largely informed by the committee and by the folks who want to participate into this program. I would anticipate, just based on how I know people like to operate, that that's probably going to be a 1-1 covenant, meaning that plan, that stop loss is going to renew on January 1st every year, just to help make your lives clean and probably reflective of what a lot of companies are today, which is a January 1. But the option there would be if you wanted to go ahead and get started. We decided on putting this all into a January 1 anniversary cell, so it renews on January 1 every year. You would write what's called a short contract for, let's say we did it August 1st. You would write a 5-month contract that then renews on 1/1. And then we would have to work with you on how you financially set those rates to account for the fact that your premiums are going to increase a little bit after 5 months. But you would effectively have like a 17-month runway of sorts. So it gets lot of nuance there. Scott, I probably did a horrible job and made that even murkier. Anything you would clarify that there?
No, you have it right. And, that's one of the things that we would make sure we help with any government filings that need to be done for that short plan year and assisting with revising of plan documents. And no one's going to be left out on an island by themselves.
And on the member deductible, if you did do something like that, absolutely. So they would not be able to keep the plan. We would need to terminate that plan when the new plan goes live. However, you can absolutely get a deductible accumulation report from your existing program and credit your members for the deductible throughout the rest of the plan year. We see this really often. The one caveat I will tell you, it's not a big deal. Heck, if you're fully insured and you're on anything except a 1/1 renewal date, you've probably dealt with this before, which is we have an 8/1 anniversary date, but we have a calendar year deductible for our members. When you change carriers on that 8/1, you go from United to Blue Cross, you have to get the deductible accumulators from United to provide them to Blue Cross so that they can accumulate that member's utilization year to date. It would work the same way. The only caveat I would give you is that the minute you print a report, it's out of date because claims are being processed constantly. So invariably, you're going to have an employee or two or three that come to you and say, hey, My Blue Cross is showing I had paid $2,600 for my deductible, but I know I paid 3,000, and they would have to provide those EOBs that came in after that report was created and provided to the new carrier. So I know that that sounds really messy and complex, really not that complex, but we run into that all the time.
The Has an insurance carrier been selected?
Great question. So we have a few captive managers that we have done business with and we feel very strongly about. One of the things we would like for the committee and the members or the folks who step up and say, hey, we want to participate in this program and we want to be a part of kind of building the construction of it. And we want to join 1/1 of next year. We want those people to have say in who the captive manager is. And so just like you would do if you were evaluating this for your own company, you'd probably look at two or three different captives. We're going to do that same exercise, but we're going to do it as a group. You're going to have other folks that are asking questions and weighing in and kind of voting on this together. So yes, we've identified the candidates, and our hope is that you guys want to select the dance partner, knowing that we sign off on all of them.
So this has to be coming from an owner of an IMB, because this is something that I would try to do. But in the questions, it's anonymous, so I don't know who it is. Our existing plan renews 1/1, but we
Mhm.
have not yet committed. Would it be possible to make the switch to self-funded within that time frame?
This is a great question, and no.
Let's go.
So I want to be very clear that part of the reason we, working with Jody and everything, we kind of landed on this time of year is these things to do them right, to do them in a way where we're not all kicking ourselves. It just takes time. And if each of you were going out and you said we're going self-funded 1/1 of 2027, come hell or high water, I would tell you to start no later than March of next year, even if you were just doing it for your own company. So what we're doing here is we're backing that up and we're engaging to basically say, hey, we think we can have a program that's available by 6/1 or 7/1, depending on, the interest that follows this call. If we get four or five people that step in and say, hey, I want to be in this, I want to be a part of this, I want to be on the board, great. That's going to get to work on selecting the partners. And the hope would be we can get this thing up and running by 6/1 or 7/1 effective dates with the plan anniversary naturally occurring on a 1/1 cycle. So what I would tell you is maybe don't make changes. If you have a renewal that you can stomach, even if it's painful, if you change carriers, you're going to be jerking your employees around if you were to join this program next year. You're going to be have basically three different plans over a period of, 18 months. And so what I would tell you is maybe if you can afford to stay
Yeah.
put and start this and look at 6/1, 7/1, 8/1, something like that.
I am hard driving and impatient, but there is no way that in the next, 27 days that we could possibly put this together. But I like the way you think,
I
whoever it
do
is that
too. I
asked
love
that
the
question.
urgency.
We're in a level funded consortium, and leaving triggers a runoff period.
hmm
We've seen some carriers often support offset those runoff costs. Is that something your organization provides as well?
Yeah, so it would be up to there's the only person who would be able to offset anything would be the claims administrator. So the run out, you're obviously paying for run out run out administration on that plan. That's something that we have been able to get TPAs to waive the first 2 months or so of admin costs so that you're not paying two administrators in January and February. And then they'll start billing in March, maybe through the end of the year. I will tell you that also depends on the size of the plan and who the TPA is. But we've certainly seen that before. Where you won't be able to get any concession is on the stop loss because you're going to have that reinsurance for the last treaty year, the last plan year. And the new stop loss carrier is going to need premium because they're covering the claims that are incurred in that new plan year. So in that overlapping time frame, your real opportunity to get that concession is on the administration, but we have done that successfully. This is also part of why it would help to go with the cooperative is if we're talking about five, six plus companies that start this, that are kind of the anchor that start it, Now we're negotiating on behalf of 5 or 6 companies. Those TPAs, those partners that we're negotiating with are going to be a lot more willing to say, sure, we can do that because we're dealing with more leverage. So that's one of those areas we could influence that.
Hey Taylor, before we get into more question and answers, because I know some people will have they'll
Hard
have
stops.
meetings to jump
Yeah.
to. So I want to go ahead and let everyone know what next steps are
Yeah.
if they want to dig deeper.
So really simple. So meet with the CCIG team to discuss kind of what y'all are doing today, and we can just really quickly and practically dig through whether or not you guys would be a philosophical fit, whether you're picking up what we're putting down and all that sort of thing. If it all sounds good and it's something you want to pursue, we would ask you to sign a letter of authorization and a mutual non-disclosure agreement. The NDA is basically just saying, like, guys, we're putting a lot of time and effort and energy, and TMC is pouring a lot of there's a lot of intellectual property coming from you guys that's going to be shared. We want this to be unique and valuable to TMC, so that NDA will be in place. The letter of authorization it's not an agent of record letter. It's not going to rescind anything that you have with your current broker today. What it does is it allows us to work with the partners within the ecosystem that we are building on your behalf. So you're not writing a policy, you're not binding coverage, it's not rescinding your AOR. It's just a letter of authorization to work with those parties representing you in the event that you decide to move into the program. We'll provide an opportunity analysis, work with the captive manager to basically sell you to them so that they allow you into the captive. And we would get an underwriting offer at that point. It would, in all likelihood, be illustrative, so it wouldn't be a binding offer, but it would say, hey, based on your risk today, here's what we would offer you. And then if everybody signs up, we go in. We would probably need 30 to 90 days from that point. And you would say, hey, we're going live. Let's do it. We build your plans. We get it all put in place. And then we're off to the races. The optional piece here is we are a full service brokerage. We do all non-medical benefits as well. So dental, vision, life, disability. We even have a fantastic property and casualty team that does cyber, GL, all that sort of thing. We can take on more, or as much as you want to work with our team on. But that's not required to participate in this. This is just your health plan. And you would not have a need for another broker or anything like that. You would have this group serving the role of your broker.
And a point of clarification on number two, that's a signed letter of authorization and the mutual non-disclosure agreement is between the individual company and CCIG. That's
Correct.
not that the mortgage collaborative for is going to sign that. So each individual company needs to do that. We have a question in the chat about how many companies are currently in the cooperative. So in the mortgage collaborative, we have 200-ish lender members. It fluctuates a little below, a little above. We have really hefty objectives for 2026 and want to grow that to 240 lender members. And we also have 72 preferred partners. And based on each of their characteristics, not all of them will participate in the insurance through the collaborative. That is to be determined. We do not currently have an insurance solution at TMC, but this is the beginning phases to be able to set that up. We are looking for 5 to 6 employers to get this off of the ground that would want to participate so that we can continue to grow it and provide additional benefit to our network through the years to help mitigate costs and risk related to health insurance.
But I do want to say there's no risk to being an early adopter. You're working with a bunch of experienced people who do this all the time. So it's really no different than you going off self-funded on your own from a standpoint of you're going to have a lot of safety in the expertise of the people that are going to be behind the scenes on this program. But where this will really pick up steam and really be a powerful snowball is when we get 2, 3 years down the road and those first 5 or 6 companies that joined look like geniuses. And then everybody can kind of draft off of it and it will get stronger over time. But that's the deal. We need a handful that will do it. And we do have one TMC client, reasonably large lender that has already stepped up and said we want to be a part of this project. They're already a current client of ours. And not only that, they have a phenomenal benefits lead and human resource officer that has volunteered to be on the committee if you so vote. So someone like that, I'm telling you, would be an invaluable resource for the rest of you as well.
Awesome. I thank you both, Taylor and Scott, for your time. It has been extremely informative for me, who have had, and I've had this conversation with you numerous times over the years. So thank you so much for the information. And please, anyone who is interested, please reach out to the team. We will share the recording for anyone who was registered. But if any additional questions come about, reach out to your member engagement team, reach out to myself directly, reach out directly to the CIG group. But we're here to answer questions for you, and hopefully we can make this a reality in the not too distant future. So thank you all so much for your time.
Thank you. Thanks,
Thank you.
Jody.
Bye.